As we've worked with dentists over the years, we've identified that the dental patient and the sleep patient are very different. During this section, we'll talk about the 3 common phases that a sleep patient goes through before they decide to go forward with treatment, and how you can intersect your brand with each of them and make a connection. But first, let's talk about a few fun stats. According to various sources, 20 to 30% of the entire US population over 30 has sleep apnea. On the other side of that, 80% of those people are undiagnosed with sleep apnea. They're living with it. And if you take a wider lens, the US only makes up 54% of the worldwide market. So the market is exploding. There are tons of people out there that are not only affected by the condition, but are also looking for treatment. And you wonder why you're seeing Inspire ads during the Super Bowl. So how do you stand out from all that noise? How do you make that connection? It all starts with intersecting with these 3 phases and connecting on the point that their pain of having sleep apnea is often dwarfed by the perceived pain of treating sleep apnea. People are scared to treat their sleep apnea. There's a lot of easy fix options that they think they can go with. You've got to get in touch with a doctor. That can always be a pain. You've got to take a sleep test. Assume you're going to be doing in a lab with wires attached to you. There's no way you're going to sleep during that, right? And then finally, you think you probably need to go under the knife or get a CPAP. And you're going to be looking over at your partner in bed, or your bed partner is going to be looking at you with a mask and hoses attached to you. You know what I'll do? I'll just go on Amazon. I'll try something out. I'll get some nose strips. And I've always been thinking about losing 15 pounds, right? Not necessarily the case. But our job as sleep practitioners is to take that fear and those pain points and help those patients see a light at the end of the tunnel. Help them connect the pain of having sleep apnea, the impact it has on their life, with the outcome of living a better life, doing the things they've always wanted to do or used to be able to do, and helping them see that light at the end of the tunnel. The first phase of the sleep apnea journey is often educational. It's what is sleep apnea? These are people that kind of have a general interest in understanding that they're maybe not sleeping well, they don't understand what the condition really is, and they're looking for educational content from an expert that can help them maybe confirm a suspicion that they have something going on. This is also often a place where a lot of intersections happen with bed partners or family members or people that have someone that they care about that they may be thinking has sleep apnea or has a snoring problem. And they're really looking for information. They're looking for understanding of the symptoms of sleep apnea, the signs of it, the risk factors, things like that. So connecting with these patients is all about education. It's positioning and using your expertise and everything that you know about sleep to put those questions that they may be asking online. Dr. Google is the most visited doctor in the world. If you have questions about a medical condition, 9 times out of 10, before they even ask you as a practitioner, they've gone on Google and just typed in that question. The same way they would ask it. What is sleep apnea? Why am I waking up with a sore throat? So on and so forth. Having those places for those questions to land on the internet is a great place for you to help top of the funnel marketing to establish that expertise and be seen as a leader in the field, even if someone's not quite ready to take that next step and get treated or take a test. So building out content that's useful both to your patients and to other experts in the area, when you're looking at physicians who are looking for someone to help send patients to for sleep apnea, building that knowledge hub and area for your expertise is going to help take your practice and really niche it into an area where a lot of other people maybe aren't providing these types of educational pieces. You know, if you're online and you're looking for education, it's the same 5 websites all the time. It's WebMD, it's Wikipedia, so on and so forth. But for people local to your area, they can't go to those websites and get a treatment, but you as an expert in the area, they can. And so educating them at this phase is key. The second phase of the patient journey is all about testing. These are patients who have self-diagnosed themselves with sleep apnea or have been told to get a test from an employer or a physician or even a family member, and they're looking for somebody to help deliver on the test. They're also looking for someone to help make it seem easy. And it can be easy, but most of the public doesn't realize that a home sleep test is an option. Most folks are still used to the in-lab full polysomnogram that's going to be attached with wires and not at home, and they have fears that that's going to be a completely inaccurate test because there's no way they're going to sleep, right? So educating the market on the concept of a home sleep test helps connect that with the validation that they need to move forward with treatment. That validation is a huge part here because people that have gone to this part have done the hardest thing. They've decided to do something. They've taken the first step to get to treatment. And so you want to make sure that you're validating that step, making sure that they feel good about the decision and they feel good about the results of that decision. Something that's easy, it's fast, it's somewhat affordable, and really helping them understand that this first step was the right step to take and helping them move forward in the process without any sort of roadblocks. The third phase of the patient journey is all about treatment and better treatment of the solution that they have now. When we meet with dentists for the first time, we often joke that this is the money phase. This is the lowest point in your marketing funnel. These are patients that are really ready for something, and they don't have as much of an educational gap as the people that are looking for education about sleep apnea and education about testing. These are people that have found themselves intolerant to their current solution. The current solution they have is not fitting their lifestyle, and they're looking for something that can move along with them as they move through their treatment journey. These are going to be people looking for CPAP alternatives, travelers that find it arduous to bring it with them on the road, or somebody who just got distracted one day when they were cleaning their CPAP and shelved it for 6 months and all of a sudden realized that they didn't have it anymore. Connecting with patients in this phase is all about educating them on oral appliance therapy and being accessible. These patients have already had a sleep test, they're already diagnosed with sleep apnea, so they're ready for treatment and they're ready to understand the option. Comparing the oral appliance therapy against the option that failed with them is effective here. Using features and benefits, language that seems much more like selling a product than selling a service really helps connect with these patients and helps validate that you can get them to the treatment that they need without all of the downsides of the treatment that failed. These features and benefits may include the portability of an oral device, how easy it is to clean, and also needs to highlight how effective it can be. It's not going to be a lesser treatment than what they've had. It's a treatment they're going to use more frequently and more successfully than the thing that they were intolerant to. When you're connecting with these patients, you don't want to meet them at the same journey point that you meet the other patients. These patients don't need to have a screener to help them understand if they might have sleep apnea. They've already been diagnosed. They're not looking for something about testing. These patients are looking to make a transaction. They want to come into your office, understand how to get into an oral device, if it's going to work for them. And so when you're connecting with these patients, don't make it difficult. One thing that we've seen time and time again is websites and marketing and social media that requires everybody in every phase of their journey to do the same thing. And customizing the way that they can get in touch with you based on where they are in their journey is something that we'll talk about later on when we talk about websites, but it's also very important when you're thinking about how you position the people in each phase of their journey. And so when you're connecting with someone who's looking for a CPAP alternative, they're looking for treatment that's going to work better for them, don't make them do all of the steps that everyone else does. They just need to give you a phone call, put in their email address, and have you contact them, and then move forward with treatment. Now that you kind of understand the 3 stages that each patient goes through, you can start understanding how to build a brand that delivers a cohesive message during all of that and can connect with people and scale with you as you grow.